So in this classifications of cardiohypertensive drugs, there are diuretics in which thiazides or moderate saline diuretics, high saline diuretics like furosemide and betadines form thiazides, hydrochlorothiazides, chlorothiazides, benzothiazides are there. And from potassium sparing diuretics like spironolactone, amiodarone. Next is renin-angiotensin system inhibitors. The direct renin inhibitors is alskirin and ACE inhibitors, angiotensin converting enzyme inhibitors. In this case, the examples are like captopril, enalapril, ramipril, etc. You have to just remember pril. Then angiotensin receptor blockers, losartan, valsartan, telmisartan. Then sympathetic inhibitors, beta adrenergic blockers, propanolol, metoprolol, atenolol, beta alpha plus beta adrenergic blockers, levodopa, carvedilol. Then alpha adrenergic blockers like trazodone, prazosin, doxorubicin, and central sympatholytics like chloridine, methyl dopa. Apart from this, there are also some classifications like calcium channel blockers, antiplatelet drugs, anticoagulants. First, first we are starting with diuretic therapy. Diuretics increase the sodium excretion and relax arterial blood vessels. So, result it results the vasodilation. If dilation occurs, then the pressure in the arterial wall should be less and blood can flow easily. Thiazides are preferred in patients with adequate renal function. Organic acids diuretics like loop diuretics are used in patients with reduced renal function. Diuretics can be used alone or in combination with other antihypertensive drugs. Excessive loss of fluids, sodium and potassium are common adverse effect. Then comes to sympathetic blocking drugs like alpha blockers that lower the blood pressure by vasodilation. Beta blockers also lowers the blood pressure by decreasing the heart rate and cardiac output. Alpha blockers doing what? By vasodilation, lowering the blood pressure, and beta blockers doing what? By decreasing the heart rate and cardiac output, it's lowering the blood pressure. Centrally acting sympatholytic drugs decrease the activity of the cardiovascular centers and in the medulla oblongata. So vasodilators decrease the muscular tone and contractile functions of blood vessels. Hydrogen and minoxidils are potent vasodilators that must be used with diuretics and sympathetic blocking drugs. Minoxidil causes hirsutism and is sold topically for treatment of baldness. Comes to these things, angiotensin, renin-angiotensin system inhibitors. In this case, renin-angiotensin system inhibitors, there are previously we just revised these things. See, renin-angiotensin system inhibitors. In that system, there are three classifications are there: angiotensin converting enzyme inhibitors, angiotensin receptor blockers, ARBBs, ACE inhibitors, and direct renin inhibitors like alskirin. So this is a mechanism which I have already covered in your class. Some of the students also have this mechanism. Like this is liver, kidney, heart. So we have to just understand what are the function in the heart on this renin-angiotensin system. The renin-angiotensin system (RAS) or renin-angiotensin-aldosterone system (RAAS). This is a hormone system that regulates the blood pressure and fluid and electrolyte balance, as well as systemic vascular resistance. Okay, when renal blood flow is reduced, juxtaglomerular cells in the kidneys convert the precursor prorenin, which is already present in the blood, into renin. Prorenin to renin. When renal blood flow is reduced, then just juxtaglomerular cells in the kidneys convert the precursor prorenin into renin and secrete it directly into circulation. Plasma renin then carries out the conversion of angiotensinogen, which is released by the liver, to angiotensin 1,